Good evening to my teachers, senior colleagues, fellow YOs present today. I hope I am audible, please.
Yes, very audible.
I hear you.
Okay, thank you very much. Okay, I am Dr. Nafisat Ijayolatoke. I'm an oculoplastic surgeon at University College Hospital, Ibadan, and I am the moderator for today's webinar. So we shall be discussing a very important topic, especially to young ophthalmologists like myself, either in training or early career ophthalmologists. And the topic is building a successful career in ophthalmology. So our focus today is the academic career progression as well as subspecialization in the field of ophthalmology, while the academic committee can then help schedule another session where we can then look at how to build a successful career via the private sector practice pathway. And perhaps we can also find out whether we can also build a successful career in ophthalmology via the JAPA pathway, which is actually very rampant in our midst, especially as healthcare workers. So, but for today, like I said, our focus will be on subspecialization in ophthalmology as well as academic career progression. And to do justice to the topic, our guest today is an erudite scholar, a distinguished professor of vitreoretinal surgery with several cognate years of experience in the field of vitreoretinal surgery as well as ophthalmology in general. Distinguished ladies and gentlemen, join me to welcome the head of Department of Ophthalmology at University College Hospital, Ibadan, Professor Oluleye. You're welcome, sir. Thank you very much for honoring our invitation. You now have the floor, sir.
Yeah, thank you very much. I want to thank, I'm also a youth, because you said this is Young Ophthalmology Forum. I'm also a youth. So they say age is in the mind. So this evening, we'll be looking at how we can build an academic career, a successful academic career in ophthalmology. And this is the best time to talk about it when you are young, okay, and you are still undecided on which way to go. And I'm going to try as much as possible to let us know the benefits of choosing an academic career. I'm very sure all of us want money, but at the end of the day too, we want to balance the two sides. So I'm going to talk on how to be a good academician in ophthalmology, at the same time enjoy the practice of ophthalmology. So, but we need to know the requirements first before we proceed. So let's go on. So when we talk about academic ophthalmology, we are talking about a research-oriented ophthalmology. That's number one. So you must love research if you want to be an academician in ophthalmology. You must also love teaching. You must be willing to teach, okay? Give your time, okay? You must be able to give your time to teach because we were taught to. So you need to teach others. Number three, you must be able to mentor. Mentor is that to show direction to the young people coming behind you, so that you must be somebody who is approachable, okay? And mentorship means you could also be able to mentor even medical students, mentor resident, postgraduate students, even mentor junior colleague, junior academic colleague, so as to show them the pathway, okay? So that they can also one day say, yes, I'm also an academic ophthalmologist. Again, we must not forget our clinical care. So when you are in academic ophthalmology, it's like you have your hands in everything. You are into research, you are into teaching, you are into mentorship, and you are also into clinical care. Because originally, when we are being trained for ophthalmology, most of the time we are thinking of clinical care, take care of patient all the time. And again, you may decide to continue to focus on patient and forget all of that important things. So as an academic ophthalmologist, you have your hands in everything. And finally, you can combine the scientific rigors of research with the patient-centered focus of clinical practice. This is what an academic ophthalmology is all about. So we are going to take them one by one. What are those things you need to do? Let's talk about research first. So when we say research, an academic ophthalmologist often lead or participate in research projects. And if you look globally, global ophthalmologists, all those cases, clinical trials, of course, ophthalmology is leading in all these areas of medicine. Now, we talk about clinical trials going on worldwide. So an academic ophthalmologists are always in the forefront of that. This research focuses on vision science, multiple eye diseases, or surgical techniques. As ophthalmologists, we are advantaged because we can practice medicine at the same time practice surgery. So that is why ophthalmology is a very unique area. And this may also involve conducting experiments. You can experiment, okay, analyzing data and publishing findings in peer-reviewed journals. If you go to some of the top peer-reviewed journals in the world now, you see ophthalmologists publishing there, and you see a lot of work being done. As the world is aging, life expectancy is increasing. You may now smile because you know ophthalmologists will always be in the forefront because we continue to see more diseases of the aged. And when those ones are there, then you know that is a good thing for an academic ophthalmologist. You have a lot of teachings to do, a lot of research to carry out, and at the same time, a lot of patients to take care of. So this is a very exciting situation for me today to speak to you on this. Okay, now let's move on. So teaching, let's take teaching. I love teaching, I must tell you. So if you want to be an academic, a successful academic ophthalmologist, then you must love teaching. Now, this picture is one of my favorite pictures I took with medical students while I was doing my sabbatical in University of Lagos. You see, some of these, Lagosians, they will always be Lagosians. And you see a lot of, in those days, this was in 2015, 2016, and you can see the way, so you, as an academic ophthalmologist, you must always be approachable, okay? Not that they will take you for granted, but at the same time, you must be willing to teach, come down to their level. Teaching, that's why you must love teaching. If you want to be in the academic career, then teaching should be number one. You must love teaching. You may teach to medical students, you teach residents, you teach postgraduate students, teach fellows, teach the nurses, teach everybody that comes your way. And as you teach, you become better. As you impart knowledge and clinical skill, you get better. So to be an academic ophthalmologist is a big advantage. So I'm imploring you or young people to really want to be into ophthalmology. I think academic ophthalmology is the way. Now, mentorship, I'd also mentioned mentorship. I'm also happy when I see young people, upcoming young people come around and they want to move. They want to know more about ophthalmology. You can start mentorship as early as in medical school years. You mentor them and you tell them and let them know, show them the way, and they're always happy. And I'm happy today because I have a lot of people I mentor, and I'm happy. I have no regrets. And anywhere I go, I see them, we go for conferences, I see them, I say, yes, I'm happy that you are there. So mentorship, you mentor junior faculty and trainees, guiding their professional development and contributing to the next generation of ophthalmology. So as an academic ophthalmologist, then you must be having a lot of mentoring to do. Now, clinical care, because of us are waiting for clinical care. Now, as academic ophthalmologists, you may maintain a clinical practice. In fact, your research, your teaching is better when there is a clinical aspect to it. And it will also make your clinical care better. When you do research, when you see a patient and your mind is going through research and you are thinking of how to improve the lot of your patient, that's why research is integrated. So clinical practice is better when you integrate research and teaching activities into it. You see, you can develop new techniques. The picture you are seeing here is one of those out of curiosity, okay, how to make clinical care better. We have to use our mobile phones combined with a 20 diopter lens to start taking pictures as far back as 2014, 2012. You see, this is when we started because the need was there and there was need to teach our patient education and to teach students, to teach postgraduate students, residents, how to identify it. Because the doctor will always see what is inside the eye of the patient. But how about the patient? You want them to know what you are seeing. So the issue of integrating research into clinical activities is very important. So you now develop a critical thinking, problem-solving mind as an academic ophthalmologist. And you want to say, how can we solve this problem? There was no available fundus camera at that time. And we got talking, and we got research, moved into the internet. We started searching, and we saw that it's possible to take picture with the mobile phone. And you can use that to even do telemedicine to teach your patient, teach residents, and also impart knowledge worldwide. You can do research, and we publish a lot of papers using this manual. Now, collaboration. That's another important aspect of a academic ophthalmology. So your collaboration should start now when you are young. Collaborate with people. Don't limit yourself. Don't work in silos. Move out of your comfort zone. Okay, develop friendship, conferences, attend conferences at this time. Don't stay in your locality. Move out. If you need to do sabbatical, move out and do sabbatical in other areas. Okay? I remember in those days when we did sabbatical at University of Lagos, they say it's unheard of for anybody to come to University of Lagos to do sabbatical. I said, I'm going to do sabbatical there. And that's what happened. And when I applied, they said, yes, you can come. So don't stay in silos. Try and collaborate. Move out. And that decision was a very wonderful decision. And I have a lot of mentoring to do at that time. I'm still mentoring a lot of people in that area. And you see a lot of these people you are seeing in this picture, they are now very big people elsewhere. And I'm happy to be in that academic ophthalmology field at that time. So for young people, do a lot of collaboration, and you have a lot of research collaboration. I remember it was in this Guinness Eye Center that we started the use of mobile phone to capture eyes of babies with retinopathy of prematurity. Can you imagine? At that time, and that was the first time it took place, and we had to publish it in European Journal of Ophthalmology, and it was very widely accepted. So collaborate, leave your comfort zone, and you'll be a good academic ophthalmologist. Now, advancement of knowledge. Academic ophthalmology contributes to the advancement of knowledge by exploring new technologies. We have talked about this technology where the patient lies down and you just take your phone and you are seeing everything inside and you can record. Developing innovative treatments and improving patient outcome. So as an academic, you have the advantage of doing research, okay, looking at what is the latest development going on. You can also complement that research. You can do it in your locality, okay, and at the same time, you can now give your best to your patient. That is a very important part of being an academic ophthalmologist. Now, what are those paths to our academic career? So for young people that want to be an academic ophthalmologist, based on my presentation this evening, A successful career in academic ophthalmology requires a strong foundation in undergraduate studies, medical school, residency, and fellowship training. And all of you already have that strong foundation. All you need to do is just develop yourself and make up your mind that I want to be an academic ophthalmologist. And like I told you, academic ophthalmology has everything in common. You have your clinical, you improve clinical teaching, you have mentorship, you have research, and you are able to give the best to your patient. Collaboration is there, and all that. And all this is what a successful academic career. So you need to make up your mind now and say, I'm going to start building myself up. Number two, accumulating research experience during training and through projects and publication is crucial. So when you see a patient, report. Whatever cases that you see, report them. Okay, this is how you build your academic or you accumulate your research experience. Okay, reporting. If you just see a patient and you keep quiet about it and nobody knows about it, another individual somewhere else will publish that and will take the glory for that. And you will say, oh, I saw something like that in the last 1 year. But if you are not pushing it out, nobody will be able to do it for you. So develop that inquisitive mind. Once you see an unusual case, report it. And that's the only way that you are going, because the internet now stores everything. Once you are reported and it's there for life. Number three, building connections within the ophthalmology community. Come to OSN conferences. Come to your subspecialty conferences. Okay? Workshops, webinar, develop these connections. Mentorship programs can open doors to academic opportunities. So there are some of these that we met in conferences, merely discussing the issue of even fellowship is possible when you go out and you build connection. Over a cup of tea, you can say, I'm interested in this fellowship. I want to do oculoplasty. I want to do retina. I want to do that. And during those conferences, when people have breaks, that's the best time to build connection. And you'll be amazed at the number of connections that are built at that time. So come out and try and join these conferences and workshops, and you are not going to remain the same. Once trained, individuals can now apply to faculty position in academic medical center. And in Nigeria, we have a lot of academic centers now in ophthalmology, a lot of university teaching hospital, research institute, even private teaching hospital, private universities are taking in a lot of academicians. And there's a lot of vacuum now, and that is being created. Okay, so this is the time to make up your mind to be an academic ophthalmologist. Now, benefits of an academic career. What are the benefits? Academic ophthalmology offers a stimulating environment for intellectual growth. You see, like I mentioned earlier, you are not just seeing patients, okay? You think of research, you teach, okay? You mentor. As you are doing all this, you are stimulating your intellectual growth and exploration. So that is the advantage of being an academic ophthalmologist. You have your hands in everything. You are balancing research with your clinical work, at the same time making the clinical work better. You see, that's the advantage of the benefits. Academic ophthalmologists can make a significant impact on the field by advancing knowledge, developing new treatments, and training future generation of specialists. So this is a joy when you train people. When you are an academic ophthalmology, you are involved in training. And that training is not for the now, it's for the future. Okay? And by the time you sit back and you watch all the people you have trained, you have that sense of fulfillment. That is why an academic ophthalmologist is usually very happy and fulfilled, and you make a significant impact on the field by advancing knowledge. Number three, academic setting often provide opportunity for professional development. Yes, let me give you this, because when I started in an academic setting, I was taken as a lecturer one, the University of Ibadan, College of Medicine. And there were opportunities for professional development. That is when I had the opportunity to go for my fellowship. Okay. And all other courses kept coming, and I started taking them. You see, that is the academic setting, and that is where you provide that, and that provision for professional development takes place, including advanced training in a specific area of ophthalmology, like fellowship. It always comes during academic setting. You have the opportunities there, and even the academic environment will encourage you, and they will give you leave, study leave, to go for those training. That is the importance of being an academic environment. So it's a good, big benefit. Now, I had the opportunity, okay, of listening to some academic ophthalmologists, and some of the questions that were asked them. And I'm going to replay all those now so that all of you can listen. Now, the first question was thrown to a very good and experienced academic ophthalmologist. The question was, who makes a good academic ophthalmologist? And the answer from this experienced individual was someone who is inquisitive. So as a young individual, you must be inquisitive. You must love the challenge of scientific endeavor, has good leadership and mentorship skills, and is approachable. I mentioned that earlier. You must be approachable. And someone who is generous with his or her time. You are not the person that is always in a hurry to move. You must be generous with your time. You must listen attentively. Okay? Be able to give yourself to this program. Academic ophthalmologists require time. So you must be generous with your time. You must be able to teach, inquisitive, challenge, scientific endeavor. When you see a new development, you must be able to critically appraise and say, oh, what can I do to make things better? Is there a research I can carry out in this area? That's who makes a good academic ophthalmologist. Number two, how does your academic role influence your clinical role and vice versa? Okay, because at times you tend to think there should be a conflict. No, it makes the individual reply, say, it makes me critically appraise the treatment I give my patient. You know, when you're in an academic role and you are looking at your patient, there is a different way you look at those patients to be able to say, are they benefiting from this treatment? It's not just hook, line, and sinker because it's written, this is the treatment, then I should give the patient this particular treatment. You now critically appraise the treatment. That's why the issue of studies, okay, research, studies takes place on patients to be able to say whether the treatment you are given is correct or not. You can compare treatment. You can do randomized trial and see whether truly this patient is benefiting from this. Seeing patients helps me to direct my research so it is clinically relevant. Now, as an academician, when you see patients that keeps coming in and out, then your critical thinking should come out and say, how do I make all the research I'm doing clinically relevant? That means you must see the need in those of your patients to say, oh, this is the kind of research I want to do. And at the end of the day, if you put that into consideration, you'll be able to help your patient. Next question. Is eye disease particularly appealing for research? Definitely, eye research is often at the cutting edge of medical research and has many firsts, including proof of concept studies. If you look nowadays, most of the big studies, anti-VEGF, is more with the ophthalmologists, academic ophthalmologists, and the cutting edge of that. Okay, studies, and we have a lot of them coming up. The eye offers unique possibilities for gazing into the CNS with tissue imaging and detailed observation in vivo. Now you see a lot of images coming up. OCT is there, fundus photograph is there, angiography is there. This eye is the only place you can look inside and see the vessels and see the nerves. Okay, this is a unique opportunity. Okay, and it's very appealing for research. There is also an inbuilt control, the other eye. You see, So you are working on one eye, you can use the other eye. That is an inbuilt control. So it's appealing for research. Next, why do you like being an academic ophthalmologist? This question was thrown to somebody experienced, and his response was, I never have a routine day. You see, as an academic ophthalmologist, there is always a different challenge every day that is there to solve. Very innovative challenges and very satisfying reward. I have a mix of clinical and research work, which keeps me stimulated, and colleagues tend to refer interesting and challenging clinical cases to solve. You see, that's the life of an academic ophthalmologist. Very interesting. Every day you must receive what we call referrals, people trying to find out what is the next thing that can be done for this patient. And I usually enjoy it. And with WhatsApp now, I see a lot of referrals. Is it fundus photo? Is it OCT? Is it angiography? You know, and this makes things very challenging and interesting. It's never a routine day. So that is the life of an academic ophthalmology. Now, the next question, what do you like the most about your job? This experienced individual said, when things are going well and funding falls into place, that's another thing about an academician. You can approach funding organizations to give funding, and you have the opportunity to really explore new ideas. There is nothing quite so exciting as going into the unknown. You see, that's the life of a researcher. You don't know where you're going yet, but you have this zeal that I must pursue this and find out the end result of this study. I also enjoy the wonderful partnership and collaborations you can forge. You see, often this leads to really deep and lasting friendship with like-minded people. I don't think work can get much better than that. You see, so that's another thing about the life of an academic ophthalmologist. And why did you choose academic ophthalmology? That's another question to another experienced academic ophthalmologist. And he said, academic ophthalmology provides a unique balance between clinical and research activities, and is always interesting and never monotonous. You see, it's never a routine. You see things differently every day. That's the life of an academic ophthalmologist. What are the most important skills an academic ophthalmologist should have? Number one, determination to succeed, highlight to curiosity. You must be curious. Your mind is always alert, and you are trying to find solutions to problems. And aptitude for original thought. Yes. So that's why research is all about. Academic ophthalmologists. Do you think the future is bright for academic ophthalmology? More medical research is taking place now than at any moment in history. And academic ophthalmologists are leading the way in basic science, translation research, and clinical trials. Yes, we are all aware of this. As people live longer, ophthalmology's substantial share in disease of aging becomes even more important. And this is being reflected by an increased share of research funding. And we all know that the world is growing older and older, and life expectancy is increasing. So you expect to see more and more research funding in this area. Very important. So in summary, academic ophthalmology can offer an extremely rewarding career. So as clinicians, we are often at the cutting edge of modern medical care, and as scientists at the forefront of medical science. By having a foot in either camp, that is, you are an academic into research and you're also into clinical care, okay, and you can understand the translation from one to the other. The aspiring academic ophthalmologist needs to be enthusiastic and driven to find answers to difficult questions, in addition to providing day-to-day clinical care to patients. So you have both worlds in your hands. As an academic ophthalmologist And as a clinician, you can marry the two together in order to give the best care for your patient. It is not an easy road, let me tell you. It's not an easy road to be an academician, because you publish, you must continue to publish. There is a word that we used to say, publish or perish, is still available in the university system or research institute. You must be alert and be ready to have your publication. Your name must be on Google. You must be on ResearchGate. You must be in academia, okay? And you must have that citation index that is attractive. So it's not an easy road, but the earlier you start, the better. But can offer unique opportunities for autonomy, scientific endeavor, and collaboration with like-minded people. Like I mentioned earlier, collaboration is the way out. Okay, don't work in silos. As you collaborate, you see the research work will also increase. Attend conferences, attend webinars, attend all these stimulating webinars. Okay, don't be in silos. And at the end of the day, you will not regret it. So as young ophthalmologists, this is the time, if you are thinking of an academic career, then you need also your professional development. Don't just be satisfied being a general ophthalmologist. Move into subspecialty. And I'm happy to tell you now, both the National College and the West Africa has started subspecialty. The National College also have concluded their curriculum for subspecialty. So subspecialty ophthalmology is the way. And once you're a subspecialist, then academic ophthalmology will be easier for you. Okay. I think at this point, I must say thank you to everybody and for the Young Ophthalmology Forum for this opportunity. Thank you very much.
Thank you very much, sir. It's been a beautiful and very, yes, sir. Thank you very much, sir. We appreciate you, sir. It's been a very beautiful and quite concise lecture. And I'm sure a lot of wiles like myself who either though were confused about choosing an academic career would have been able to make up their mind. So briefly, I'll just give a short summary of the lecture, and then we can entertain questions if we have any. So Prof told us the components of academic ophthalmology, where he said is comprised of research, teaching, mentorship. We can be within the university or research setting. And of course, there's also clinical and care. And he said to be an academician, you must love teaching. You must be able to offer a mentorship role to younger trainees. And then you must also offer clinical care. You must be able to integrate clinical research with practice. And then you must be able to collaborate as well. So he also talked about the path to being an academic academic career. And he said that you must have a good foundation, medical school, residency, and fellowship, which we already have as YOs. And then must also accumulate research experience during training. This is very important, especially for residents. You should undergo research and publish our work. And we must also build connections via attending webinars such as these, workshop, conferences, both local and international. And he also listed a few benefits of academic career. Said it offers a stimulating environment for intellectual growth and exploration, and also it helps them to have a significant impact in the field of advancing knowledge, where you can integrate your research with clinical work. And also it provides opportunities for professional development. So that's, but he also sounded a note of warning that it's not a very easy pathway. You must be ready for the challenges of combining academic work with clinical work, with research work. But he said at the end of the day, it's actually gratifying, and it gives a lot of satisfaction. So quickly, we'll take questions. We can actually raise up our electronic hands if you want to speak, while I would read the question that we have here. Thank you very much, Prof. Please, what course or additional training do you recommend in order to excel at academic ophthalmology? So,
Okay.
Prof, yes.
Yes, I can hear you.
Yes, the person wants to know what course or additional training.
Additional training.
Yes.
Yes, because you are young now, this is the time to go all out. If you must have a research methodology course, is very, very important. You may have had them during your training, but an advanced research methodology course, I think, will be an advantage at this. Some of us, after training, we still went for master's program, and that singular act alone can also help in sharpening your research skills, because as an academic ophthalmologist, you need to be on top of research. Okay, so that's one important area, the training that you can do. I also mentioned the area of specialty.
Thank you very much. I think you have also answered the next question.
Yes, I also mentioned the issue of subspecialty training. If you just have a general ophthalmologist, this is the time. Yes, I can hear you.
Hello, am I audible, please?
Yes, you are audible. I can hear you.
Hello?
Can you hear me? Yes, I can hear you.
Okay.
Hello?
Okay. Yes, sir, I can hear you now. I
can
hear you now,
okay.
sir. Yes, I can hear you.
I think in addition to the research aspect, you also need this subspecialty fellowship. Subspecialty fellowship is very, very important, and it should be one of those things that will also sharpen your clinical skills. As you are sharpening your research skill, then you can also sharpen your clinical skill. Some of us also went ahead to do education courses. Okay, I went for a master's in teaching and learning. That's another area that you can also improve your academic program, because you need to know how to teach. Okay, it's not because we are not trained as MBBS or resident or in ophthalmology to teach. So you need to know how to teach, because there's a different way the learners will accept you if you don't teach well. So this issue of teaching, mentorship, all those come from the postgraduate training in teaching and learning. And all this you can get online. So you don't need to say you are traveling to another place. I did mine online, teaching, learning and teaching, master's program. So these are the things that I think you need. So the moment you have your research done and you have your subspecialty and you know you have a course in education, I'm very sure those education courses are also available in our Nigerian universities. Okay, so very important in academic ophthalmology. I think I'll be able to answer that question.
Yes, sir. Thank you very much, sir. I think you have also touched on this next question, which is, thank you, Prof. Could integration of MSc and PhD into residency training of both colleges stimulate academic interest and growth?
Of course. So I think that is the problem we are having nowadays, because these two were not initially integrated. I think they should be part of the residency program, so that by the time you finish your residency, you are armed with everything you need to be an academic ophthalmologist. I agree with you. Yes.
Yes, sir. Just to buttress your point, sir, I think the National Postgraduate Medical College has introduced the MD program, which is Doctor of Medicine, which is considered equivalent to PhD and acceptable by NUC. So I think it's still in line with the question. Thank you, sir. So the next question. Thank you, sir, for the very inspiring lecture. The sub-theme for our next OSN conference is the role of international collaboration in ophthalmology. We are eagerly looking forward to welcoming YOs to Kano. where we hope to hear insightful perspectives on how collaboration is shaping the future of ophthalmology. Okay, this is just a free PR for the upcoming.
Yeah, that's a very good thing to do, because
Yes,
collaboration now is the way to go. You have to collaborate. All right.
yes,
That's
sir.
good. Yes.
Okay, sir. I also have a question, sir, and I'm sure a lot of
Okay.
YOs would like to know, sir.
Yes.
There's an aspect of academic ophthalmology which I would love you to touch on, which is so my question is, how financially gratifying is academic ophthalmology?
I'm very sure you know the answer already. In Nigeria of today, it may not be appealing, but like I mentioned, you have a passion for academic ophthalmology. When you start and you start receiving research grants, because of course, when you start doing research, because the African setting is fertile for research. You know, most of the research we read in papers are things coming from the US, from the Western world. Okay, and Asia
Yeah.
is coming up to now. So Africa, the world is waiting for research to come out of Africa. And the funding agents are, let me give you an example. In UCH, we have the glaucoma research, one of the biggest glaucoma research grants available, the so-called Eyes of Africa research. I'm very sure, Dr. Latuke, you are aware of this.
Yes, I am, sir.
Yes. So if you are patient enough and you think critically, you will identify a lot of fertile research ground that is available for Africans. We have a lot of diseases, okay, affecting the eyes. Diabetes is there. Not enough research is done on diabetes and the eye, okay? And
Yes.
a lot of funding agents are waiting, okay? So, yes, gratifying financially. If you think critically and you identify those research areas and you get the grants, yes, it is. Of course, you use the money for the research, okay? But definitely there's something coming out for you after the research. Currently, we are doing a lot of work on artificial intelligence. And these people are waiting, the world is waiting for Africa to break through the artificial intelligence in ophthalmology. Not much has been done, okay? So there's a lot to be done, and there's a lot in the horizon. Okay. Thank you.
All right. Thank you very much, sir. So we have another question, sir. Which is better and easier in your view, towing the MD line or the PhD line? Excuse me.
I think the MD is easier. Okay, at least Dr. Latoke can talk more on that. She has an MD in ophthalmology. The MD line is easier. I also have two of my colleagues who have PhD, all right? And one of them actually had 2 PhDs. You see, that's to tell you that if you put your mind into something, you are definitely going to get it. So I think using the MD is easier now in Nigeria. Okay?
Yes, I agree with you, sir. Especially as residents, I think because it has been integrated into residency, so it's just like you're doing 2 pari passu, and then at the end of the day, you have 2 certificates to show for it.
Yeah. Okay. That's
okay. True. Yes, sir. Thank you very much, sir. It's been a very stimulating session. So in the absence of any question, I would like to call on the chairman of the Young Ophthalmologist Forum, Dr. Batsuri, to just give us a closing remark, I guess.
All right. Thank you so much, Dr. Olatuke. We would really like to appreciate Professor Oluleye for the time, the resource, and the impactful tips he has shared with us this night. No doubt, the aspiration of every young ophthalmologist is to join the academic line.
Thank you
one
very
day
much.
to become a professor,
Thank you.
just like Professor Oluleye. So we hope with these tips, a lot of our young ophthalmologists will develop interest and start building a career in the academics. Thank you so much. We really appreciate Prof.
Thank you. Thank you. Thank you.
Yeah. All right. So we're looking forward to having you another time.
Yes.
very soon for the clinical part.
All right.
We'll reach out. Thanks. Yeah.
Yes, my pleasure. Thank you.
Thank you very much, sir.
All right.
Yes, sir.
So good night. Good night to everyone.
All right. Thank you, sir. Thank you very much, sir. Thank you to all the participants. See you some other time.
Okay.
All right. Good night. Yeah.
Bye.
Good night.
Bye.
Bye.